Many people picture Superman as an invincible superhero. He is strong, bold, and mighty. However, Superman has a weakness. His Achilles heel is kryptonite. Kryptonite is a radioactive element that comes from his home planet called Krypton and is the only substance that can weaken Superman. Just like Superman, bacteria have weakness too. They are susceptible to the powers of antibiotics. So if you get infected, you could just take an antibiotic and you'll be fine. However, recent studies shows that there are new strains of bacteria nowadays that are becoming resistant to antibiotics, giving rise to what we call as superbugs or antibiotic-resistant bacteria. Antibiotic-resistant bacteria are also known as CRE or carbapenem-resistant enterobacteria. These are deadly microorganisms that have developed resistance to regular antibiotics, and even the most powerful drugs called carbapenem cannot kill them. These bacteria are so lethal that according to the Centers for Disease Control and Prevention, published April 2013, 1 out of 2 patients who get infected by CRE will die. In a similar statement made by Dr. Tom Frieden to CBS News, updated March 2013, he said that CRE, or antibiotic-resistant bacteria, are nightmare bacteria. Our strongest antibiotics don't work, and patients are left with a potentially untreatable infection. So in order to highlight the importance of these deadly microorganisms, we will first talk about enterobacteria. Second, we will talk about the mechanism on how these bacteria build their resistance to antibiotics. And lastly will be the solutions to fight the problem. So unbeknownst to everyone, bacteria are ubiquitous, meaning they are found everywhere. Just like most bacteria, enterobacteria, or the one that causes CRE, are found everywhere. According to Dr. Jacob of Morbidity and Mortality Weekly, published March 2013, he said that enterobacteria are a class of normal or mostly normal inhabitants of the gastrointestinal tract. It can cause several minor problems, but treatment is very easy. They include the normal E. coli, which causes diarrhea. They also include Salmonella and Shigella, which are not normal inhabitants, and also Klebsiella pneumoniae, which causes pneumonia. However, people do not get sick because they are normal inhabitants of the gastrointestinal tract. This is because most people have immune systems that are stronger and they can fight off these infections. If ever you get infected, there are very easy treatments. According to Medscape.com, last updated March 2013, first-line treatments for bacterial infection include amoxicillin and cephalexin. So if that doesn't work, doctors try to use stronger antibiotics until they resort to the most powerful drug called carbapenems. Unfortunately for some people, even the strongest, most powerful antibiotic don't work, causing antibiotic resistance. So after discussing enterobacteria, let's move on to the mechanism on how they develop resistance. We have 3 ways. First is bacteria can mutate. Bacteria can mutate such that regular antibiotics don't work anymore. In a telephone interview of Dr. Lucas from Palm Springs Family Medical Center last May 2013, he said that bacteria can only mutate if a person does not finish the 7-day treatment for antibiotics. This bacterial mutation can actually look like the Transformers movie, the Decepticons or the bad robots. Once they transform or mutate, it's harder for the Autobots to take them down. So that is the mechanism of bacterial mutation. Another mechanism is when a bacteria overwhelm the immune system of infected patient. According to Dr. Cox of FDA Consumer Update, published April 2013, he said that most cases of CRE occur in patients with compromised immune system. So how does this overpowering of bacteria happen? This is like the evil counterparts of Justice League called Justice Lords. When they are complete and they are on full force, it is harder for the Justice League to fight them off. Just like bacteria, when they overwhelm your immune system, it's harder for antibiotics to kill them. And last mechanism is when a bacteria transfers its resistance gene to another bacteria. According to Dr. Tapanelli of Journal of Clinical Microbiology and Infection, published September 2006, he said that bacteria can transfer its resistance genes to another bacteria, causing cross-resistance. This transfer of resistance genes is like Green Lantern lending his ring to an evil person, so that when that evil person gets his ring, he has unlimited abilities or powers as well. So just like a bacteria, when they get the resistance genes from other bacteria, they become resistant to antibiotics as well. So those are the mechanisms. Now fear not, we have several solutions so that that won't happen. First is by washing our hands all the time. That is very important. According to Dr. Rao of Drugs Journal, published 2008, 99.9% of bacteria are killed when we wash our hands all the time. So that is why we need to wash our hands all the time. Another solution to fight this problem is when we comply with drug therapy. So if you have a bacterial infection, you need to finish the 7-day treatment. Even if you feel better early on the course of treatment. Why? This ensures that bacteria will be killed, and there's minimal chance of resistance to develop. Take note that if you have a viral infection such as colds and flu, you shouldn't take any antibiotic because that will exacerbate the problem. And lastly, in cases of CRE or antibiotic-resistant bacteria, hospitals have what we call the Detect and Protect Action Plan. What is this action plan? According to the CDC Vital Signs published March 2013, it said there that hospitals should have this program because this reduces bacterial transmission. In fact, in Florida, according to the Department of Health, published June 2011, they were able to reduce the cases of antibiotic-resistant bacteria from 44% to 0%. So now that I've talked about what is enterobacteria, the mechanism and how they develop resistance to antibiotics, and the solutions to fight their problems, I do hope that you're now aware of the problem. Just like Superman, I do hope that we can find the kryptonite for these antibiotic-resistant bacteria.
I got 10 sources.
All right.
And I really liked it because you took something that's serious